I am glad that you were able to join us on this very nice, warm day. So we're going to keep this brief. I would first of all like to thank Senator Bomke, who was able to join us today, as well as Alderwoman Cimarosa. Unfortunately, Representative Brower and Alderman Simpson were unable to join us today. Today is really an auspicious event for the Noll Medical Pavilion in that we are officially doing a ribbon cutting and a dedication for our dental clinic. This ribbon cutting really allows us to recognize a number of people who have been instrumental in making this clinic happen. It was through their tireless efforts, their support, that we are here today, and we are very lucky with the kind of supporters that we have had. The first person that I would like to introduce is someone who represents the Hope Institute Board of Directors. The Board of Directors and the trustees have been supportive since the beginning. They have really ensured and made us all believe that this was possible. So I would like to introduce Ginny Conley, the President and Chairman of our board.
On behalf of the Board of Directors of the Hope Institute for Children and Families, it's my pleasure to welcome you to the ribbon cutting ceremony and open house for Noll Dental Clinic. Sir Winston Churchill said, "Every day you may make progress. Every step may be fruitful, yet there will stretch out before you an ever-lengthening, ever-ascending, ever-improving path. You know you'll never get to the end of the journey, but this, so far from being discouraging, only adds to the joy and the glory of the climb." Today, we celebrate another step in our climb toward creating a medical home for children with disabilities here at Noll Medical Pavilion, with the addition of a very important new set of services for the children we serve. In 2007, the statewide oral health strategic plan of the iFloss Coalition, I thought that was an interesting name for a coalition, the iFloss, once again identified improved access to oral health services for persons with disabilities as a key strategic priority. The fact is that those with disabilities, particularly children, have a very difficult time accessing dental care. I can personally attest to that. My first job in state government was a children's services coordinator at Tinley Park Mental Health Center. And I very quickly learned that getting dental services for children with disabilities was virtually impossible. Behavioral and cognitive difficulties often make them more time-consuming to treat, and reimbursement rates from public sector payers remain too low. Some dentists lack training and experience in working with special populations. Will this clinic eliminate all the problems? No. But it is an important step in the journey to providing comprehensive, coordinated care for children with disabilities and effective oral health care for all. So today we celebrate. I want to thank the directors and trustees of the Hope Institute who've joined us today, my friend Jean Wilkins and Greg Scott and Dr. Rankin. Are there any others here? Without their vision and support, this clinic would not have been possible. And let me just add, without the vision and support of Dr. Bukowski and Dr. Nair, and especially Dr. Rankin, this would never have happened. So I think that today Sir Winston would have been pleased, for while there's much still to be done, today we stop to celebrate the joy and the glory of the climb. Thank you.
Thank you, Jenny. The next person that I have the pleasure of introducing has been with us every step of the way. When we've asked some pretty silly questions, he has calmly and coolly answered those questions and pointed us in the right direction. Dr. Josh Rankin is a dentist who has given us his time, his energy, his efforts to make sure that we are doing the things that we're supposed to do for children with disabilities and providing appropriate dental services. Dr. Rankin.
Thank you very much. I just want to say it's wonderful to be a part of an organization. Being on the board at the Hope Institute has been a wonderful thing. I mean, it's been a wonderful thing to be involved with the getting this dental clinic together. But I mean, it's just amazing to me how much Hope does for the kids in this area with special needs. And I mean, even at 8 o'clock this morning, Mark Schmidt even calls my office to make sure I'm going to be here at 5 o'clock and to make sure that I'll be speaking. And I said, Mark, that's May 24th. He goes, today is May 24th. So, even down to telling me what day it is. So I want to say it's wonderful to be a part of the organization. My background, my name is Josh Rankin. I'm a dentist here locally. I'm just a general dentist. I'm the treating dentist for McFarland's Mental Health Facility and also provide palliative care for Noll Lincoln Prairie Mental Hospital. And I don't have any specialty in that area, but it has opened my eyes to a special part of our community that doesn't receive the attention that maybe, you know, when we talk about access to care or underserved. I mean, these are the truly underserved members of our community, and I think it's important that it's my own personal mission, and I think our dental community in Springfield, we want to take care of especially those kids who can't take care of themselves, and really empower those people who can't and don't have a voice for themselves. So that's kind of my background. As far as this project started with a commission we started called CDAC about 1.5 years ago. And it was interesting conversation. We had dentists involved who, for years, had wanted to have some type of facility for kids with special needs for dentistry. And they had tried different things, but, you know, really, money is one thing that we identified that we didn't have. 2, we identified that there's currently, kids with special needs have a lot of disease, and then they basically get surgery every 5 years or so. And that's kind of the way things shake out. So what we decided to do is, since we didn't have enough money for a $2 million surgery center and doctors to staff it, we decided to kind of create a program here that would help create health maybe at a little more grassroots level for the kids with disabilities. And so now I'm glad that that's finally come to fruition, because I think Dr. Jones and Kim Trapani especially, they've both done a tremendous job in making this, what we're talking about, real for a lot of kids already. So I'm just happy to be a small part of it, and I just want to say thank you very much for letting me, and Dr. Jones.
Thanks, Josh. Obviously, you can't have a dental clinic without a dentist. And that's one of the things that we continued to struggle with, was finding the right person. And I know that we have found the right person in Dr. Casey Burke-Jones. I was able to be there when Dr. Jones attended the Central Illinois Developmental Disabilities Advisory Committee. I was able to hear her talk about the clinic, hear her talk about the efforts that she was making in providing support for special needs children. It was clear that she had a passion and a real commitment to providing appropriate services for these children. She is adamant and a great advocate for these kids. I do get a bit frustrated when I continue to get these requisitions for more equipment, but I know that she is going down the right path, and the right path with her staff. Dr. Jones.
I just want to thank everybody again for coming. I'll tell you a little bit about what we do. We see the special needs kids, and Dr. Rankin was talking about, that really are limited care for dental care. The kids that we see will maybe go to general dentists. Some of the general dentists just look at them in the waiting room and say, there's no way, and send them to a pedodontist. The pedodontist, once again, in the waiting room will say, yeah, they're a hospital case. I'm sorry, we're going to have to sedate you. There's nothing we can do here for you. And set up a hospital date and get them the care that way. What we do is, we've had parents call that say, oh, our kids, you can't have anything done without sedating them. They've only been hospital care, but we've heard about you, so we thought we'd give you a try. And we've actually had Even though we've only been open full-time since April, we've actually had many success stories with our kids where we've had the parents, sending emails, calling the next day, thanking us so much. And we're able to do fillings, cleanings, and everything on kids that were only hospital sedation before. So our program is really spent taking time to see the kids, introduce them to dental care, introduce them to the mirror, our dental equipment, our suction, which a lot of times is very scary for our kids. The different sights, the different smells, and different sounds to make them comfortable with what we're doing. In a general dental office, things that might take 20 minutes to do on a kid might take us an hour after 5 appointments. And then it might take another hour to do one filling that might take a general dentist 20 minutes. We really are taking the time to set aside for the kids and make sure that what we're doing is good for them. We don't push any of our kids. We don't use sedation. We don't use any of restraints or anything like that. We just kind of go with our kids and make them comfortable, and through multiple appointments, they're able to then have fillings done, which normally they would have to be sedated in the hospital. So not only are we saving the parents the anguish of sitting in the waiting room waiting for their kid to wake up from general anesthesia, but we're also saving the child the anguish of going to a general dentist and being anxious and not knowing what's going on, not knowing, that we're going to rinse your tooth and what the water and everything is going to feel like. We also have a lot of kids that come in that are nonverbal and do not know anything. We do have some kids that come in with signing, so our whole entire staff is learning signing and everything else so that we can try to communicate with everybody that we do see. We try until the parents say, you're great, we're coming back, and they are just loving us for being here. They're very, very thankful, and we are getting many success stories. We're seeing a lot of kids now that are coming in and excited to be in the dental office, which I don't know how many of you are excited to go to the dental office. Our kids are excited to come see us, so I think we're doing a real good service here, and I'm glad that you guys all come and join us in celebrating this week.
Recognition of those persons who have really been instrumental in this dental clinic could not be possible, could not be complete without recognizing the Illinois Children's Healthcare Foundation. ILCHIEF has supported this dental clinic with their generous grant as well as their consultation. It's really been phenomenal, the partnership that we've developed with ILCHIEF and the support that they've provided. I'd like to introduce one of those people who have made this dental clinic possible, and that's Bob Egan from ILCHIEF.
The Illinois Children's Healthcare Foundation has one mission to improve the health of all children in the state of Illinois. In 2007, the foundation embarked on an oral health initiative. Over 5 years, the foundation has committed a minimum of $20 million to improve access for children throughout the state. To date, the foundation has committed almost $13 million to building and expanding clinics, providing education and outreach, training primary care providers to do initial exams, and working with the 2 dental schools in the state to help give dental students greater experience working with children in underserved areas. As our work intensified over the past few years, we overwhelmingly heard the need for oral health care for children with special needs. We heard stories of parents driving hundreds of miles throughout the state to access services. And we heard lots of these stories. It's because of these stories, a great need that the foundation is particularly delighted to be part of this great initiative. And we know that children will receive the services they need. Thank you. Congratulations.
Under his vision and leadership, Hope has, over the last 7 years, to continue to grow and flourish. Maybe flourish is the wrong term to use in this state budget year, but let me say flourish. This dental clinic is just one of the many initiatives targeted at improving the lives of children with special needs that Dr. Nair has championed. Please welcome the President and Chief Executive Officer of the Hope Institute for Children and Families, Dr. Joseph Nair.
What we celebrate here today is the beginning of something great for children. And I'm fortunate to be able to work with and lead an organization that asks a question often: what if? What if we did this? Or what if we did that? And several years ago we said, what if we opened a dental clinic for children and maybe even adults with disabilities who need access to, and seek access and require access to quality dental health care? And we talked, and like a lot of initiatives, it doesn't move very quickly. And then suddenly you meet the right people, the right group of supporters, the right doctors that come out to your campus and say, I want to do this. How do we make this happen? And they form a commission with other doctors, other great people. We have legislators that come in and say, we can help you do this. We have donors and foundations that come to say, we can help you do this. It's needed. And that's what's happened. It's all about the people. It's about Dr. Rankin, who came out to our campus and began treating our children on our campus and said, there's another way to do this. We said, we know, we've been thinking, how do we make this happen? It's like Dr. Burke Jones. You find the right doctor, Kim Trapani, you find the right people, and things start moving in the right direction very, very quickly. We've been seeing patients here for several months. I come in and it's a great thing to see that there are children happy to see a dentist, and I'm looking at my children recognizing that's not always the case, even though Dr. Rankin is standing right up here and seeing my children. We have a lot of people to thank, and let me highlight a few of them. I want to thank certainly Senator Larry Bomke, Senator Deanna DeMuzio, Representative Rich Brower, and Representative Raymond Poe. We passed some vital legislation that in time we think will support other clinics to open, and that's so very important. We thank Congressman Aaron Schock, Congressman Schickus, and Senator Durbin for their generous support. We also thank Alderman Cimarosa and Alderman Simpson for their steadfast support of the Hope Institute and all the children we serve. We have partner agencies, and we mentioned the Illinois Children's Healthcare Foundation, leading the way for improving health care for children here in Illinois. We also have members of the Children's Healthcare Partnership here at Noll, nonprofit providers coming together to make a different day for children to meet their needs. We have SIU School of Medicine, the Mental Health Centers of Central Illinois, and the Autism Program of Illinois, all coming together now with Noll Dental Clinic to make for a better day. We're very pleased and grateful to have those partnerships. We want to thank the dental community here in Central Illinois, a very giving group of people. We now have a list of volunteer dentists that want to come into this clinic and support Dr. Burke Jones and Dr. Rankin in their vision. I've maintained, like many of you, it takes a community of supporters to support a community. We're pleased you're here to support us tonight. You know we count on your support, and we're not shy about asking for it. We realize this is only the beginning. There's much hard work to be completed. Ongoing support is very, very necessary. But we're confident that working together with these great people, with you, that it's a better day for children, for dental, for mental health, for healthcare in general. It's a better day. So thank you very much.
Thanks, Dr. Meyer. The final task of the afternoon is our ribbon cutting. The Hope Institute is a proud member of the Greater Springfield Chamber of Commerce, and I would like to call upon Mr. Gary Plummer, who is the President and CEO of the Chamber, accompanied by his ambassadors, to preside over the ribbon cutting ceremony. Mr. Plummer. Not here? Oh. Senator Bomke.
Why don't we do it right in front of the podium here? Have our board members, our speakers.
Oh, you need to hold it. We'll put the person actually right here in the middle.
Jim and Dr. Burke Jones. You won't be cutting together with
We only have one scissors.
No, you can each.
Oh, it's on the side. Oh, I'm really sorry. Scissors.
It's a great work. It's a great work.
Go ahead and scooch in if you can. We'll probably have to make a couple rows so you get everybody in. Go ahead and hold on to the ribbon. Okay, we're going to take 3 pictures. We don't want you to cut until the 3rd picture. I said that the other night at the Parents Pavilion, and she cut right after I turned around. All right. We're going to have to scooch in a little bit more if we can. Okay. Alex, can you pull the ribbon? Okay. Good. We got everybody. Here's the first picture. 1, 2, 3. Somebody liked it. Second picture. 1, 2, 3. Okay, third picture, and we'll cut on 3. 1, 2, 3.
Here, here.
Thank you all for joining us. I hope you'll be able to stay for tours of the clinic and for refreshments.